Good evening. Good evening, everyone. Welcome to Fertility Talk live. So we are talking to Barth, and we're just going to wait a couple of minutes for everyone to come on to get the notification that we are live. So thanks everyone who's joining. Hi, Steve. Pumeza, Althea. Hi, Althea. Hope you're well, girl. Hi, Sadia. Osman, welcome. Beware. No. Okay, so I'm just going to wait for Barth. So we're speaking to Barth from Repro Lab. And we're just going to wait for Barth to get the notification that we are live. And we are talking about male infertility and diabetes. So I don't know if any of you know that diabetes does affect male infertility. And we're going to discuss that tonight with Barth. And Barth is an embryologist from Repro Lab, and we'll just wait a couple of minutes for him to join us. Seho, hi girl. Hope you're well. Hi everyone. Hi Osman. So we'll just quickly give him a couple of minutes to see where's Barth. Okay, so guys, if any of you, first of all, we've got a fertility support group for women or couples that's dealing with infertility, and I do suggest though that it's more for women. If you are in the Cape Town area, please do join us. There's one also at Vital Lab in KZN, so any of you that are in KZN, there's one there as well for you. I think that one is happening in April, 22nd of April. And next week, the one in Cape Town, it's at Cape Fertility Clinic on the 14th. DM me if you'd like to join, please, because we've got limited spots. It's absolutely free, no charge whatsoever. You don't even have to give your name. Just DM me and let me know you'd love to join us, because we've got a few spots only. Then the other thing is, if there's anything in particular that you guys would like to discuss or have me discuss with one of the fertility specialists or embryologist or anything like that, send me a message, add in the comments, anything like that, and I'll discuss it with them. We'll try and book a date for that topic that you want to discuss. Maybe there's something in particular that you're going through that you haven't heard us talk about. In that case, then let me know, and then we can discuss it. So just DM me or send me an email, info@fertilitysolutions.co.za. So I'm just waiting for Barth. I don't know where Barth is. Let me just try and see Repro Lab. I think it's getting it now. Hi, Shaq. Hi, girl. Here we go. Barth, you joined us.
Hello,
How are you?
I'm fine. How are you?
Good, good. Always great seeing you, chatting to you.
Thank you.
So,
Thank you. Glad to be chatting to you too.
thanks. So if we're talking to Barth, we're talking about male infertility, always, almost. Which is great because I think you're more representing the male side of things, because we're always discussing, the female side of things. So,
Okay. Definitely. Although when it comes to fertility, both male and female are included, but we
yes,
focus mostly on the male side. That's
yes,
why the fertility thing is a team play. We have a part that play with work with the woman, and the other side that work
yes,
with men, and then we
yes,
bring everybody together.
yes, absolutely. So when we're talking, like I said, when we're talking to you, we most of the time we speak about male infertility, but as you said, it's always a 50-50. It's both of them, it's
Yeah,
both of
yeah,
them.
definitely,
Um,
definitely.
so so tonight we're talking about diabetes and male infertility. So one of the first things before we go on, if you can just please introduce yourself, tell everybody who you are and where you're from.
Okay, my name is Barth Tambwe. I'm embryologist and owner and founder of Repro Lab. Repro Lab is mainly based in Centurion at Unitas Hospital, and we work together with different fertility clinic like Family Matter Fertility Clinic, Stemba Fertility Clinic, and the fertility clinic here in Rudaport and everywhere else. Yeah.
Okay, awesome. So we're talking, like I said, we're talking about diabetes and male fertility. So how does diabetes affect male fertility?
Okay. If we want to understand the word itself, diabetes, it explains the high level of sugar in the bloodstream. Okay. And then in the body, we have hormone that we call insulin that is able to regulate the level of sugar. When the sugar is too high, it will bring it down, place it into the cells, and stock it for production of energy. But we get to a point where insulin is overworked and the blood concentration, the sugar concentration in the blood become too high. This can have a negative consequences in terms, for example, of damaging nerves and vessels. And we know that nerves and vessels supply blood to the reproductive tract, which is testes, the epididymis, even the vas deferens. And these two can be affected.
And then, can a man with diabetes impregnate a woman? So is it possible for a couple where the male factor is suffering with diabetes? Is it possible for that couple to conceive?
Yeah, it's possible, but the consequences are quite very high because we know when men suffer from diabetes, the quality of the sperm is low. The
Yes.
DNA of the sperm is affected. And even in the case where there is a pregnancy, it most of the time end up into miscarriages. And even if there is a live birth, that will end up in producing a deformitated child with abnormalities. So basically, it's possible, but seeing the consequences, we will rather advise male suffering from diabetes to be able to approach healthcare providers and see how the situation can be monitored before they can attempt having a child. Yeah.
Okay. So are you saying that their sperm would need to be checked properly? And I don't know if I'm getting ahead of myself now, but because of what you said, um, is it like it's not a case of just like just trying on your own? Rather go for your own sake, and to prevent miscarriages and things like that. Rather have it done through a clinic or something where you're monitored. The whole thing is monitored. Is that
Okay, no,
what
the
you're saying?
point is first to start with your general health because the sperm is part of a man's health.
Yeah.
So the first thing will be to maintain general health in terms of, for example, level of sugar in the blood to make sure it's well monitored. The diet also needs to come in, make sure you eat low carb food, a bit of movement now and then to make sure there is no immobility and to do quite enough sport as well. And then on top of that, you need to approach a health provider who will be able to check and see at what level the problem is. So before we get to a point of producing sperm or producing a baby, we want first to make sure that the male himself, his health is good, because what we do at the end of the day, we just pass on whatever we have. So if the male has a good health, then you'll be able to pass that to the resulting child. But if he's sick, if he is dominated by diabetes, the consequences are going to be very, very tough. Yeah.
Okay. Then we've got, how does blood sugar affect the sperm quality? I think you went through a bit of that now,
Okay.
but maybe you wanna something else that you wanna say about it.
Okay, definitely. It's been shown, for example, that high blood sugar, men with high blood sugar, they have low testosterone. And we know testosterone is responsible for libido, it's responsible for the quantity and the quality of sperm. So if these blood sugars are at higher level, definitely the sperm quality is going to be detrimental. And that is going to lead to a disastrous outcome, definitely.
Okay, we've got a question here, but we're going to ask that question. I see your question, Steve. We'll ask it at the end of when we've got like one more question left, and we'll ask that at the end of that. One of the last questions is, what is recommended for a couple going through IVF? with male factor infertility and diabetes?
Okay. First thing the couple need to do, approach healthcare providers so that the general condition is assessed. Secondly, make sure you have a good diet in terms of what is being eaten. Avoid to have high carbs food. Thirdly, movement is very important. And if the male partner is smoking needs to be stopped as well because that is quite deleterious. And we look also at drinking alcohol, for example. If it's excessive drinking, it needs to be pulled down. And then just go for general checkup, definitely, and see. We have a lot of techniques in vitro that can be used to check also the quality of the sperm, which is the end product, and to see what medication we can bring in to make sure the sperm that is being produced is of good quality that can result into a healthy baby.
Okay. So we're going to go back to the question I was just asked by Steve. He says that, okay, it's New Year. Welcome, Steve. Thank you for joining us. He has a question about, okay, it just went away. Okay, he has a question about sperm. Does low sperm count? Oh, it's got low sperm count, and can it be treated, and in which way? So it's a question that gets asked a lot, like, what can it take? What supplements? Maybe you don't have to give us a name of the supplement, but maybe just a supplement that contains a certain ingredient. You know, if maybe that is something that you can assist with.
Okay, the big thing when it comes to improving, Steve, hello, thank you for the question. We need to just go on a healthy diet. We need a lot of movement. And then we have medication like a Prelox, Phytomax, that we use to help and improve the sperm quality. But we have also a device that we use to check, which is called Myoxis, which we use to see, for example, if the ingredient in the semen have a lot of radicals that can damage sperm. We can do also the DNA fragmentation, but with an in vitro thing, for example, we should be also able to pick up one good and healthy sperm that can be used. So what we're going to ask to the person who has asked the question, just make sure that you improve the way of life, the quality of life, and if things don't happen, then we can approach a healthcare provider. But we know when it comes to diabetes, it can be stopped. If it's not stopped, it can be monitored. So monitoring is very important.
Yeah. So somebody that's got I know it's not part of our questions, but I want to ask is someone that's got azospermia, which is no sperm at all. Does it mean that it's like that's it? The person would never have sperm, or if he does do the lifestyle changes and take medication, can it change, or is it like, you know, that's it? There's no sperm.
Okay, we need to investigate and find out what is the cause. Okay, we have two types of azospermia. We have azospermia where it's due to blockage of the tubes. So the tubes are blocked and the sperm cannot come out. That can be usually treated in the lab by doing the procedure that we call sperm aspiration. So we can go straight to the testicle, aspirate some tubules there, and check them under the microscope. We should be able to see sperm if it's there. But if then there is no sperm at all, then the patient needs to consider maybe sperm donation. If not sperm donation, maybe get a child somewhere where they can accommodate. Because definitely we cannot produce sperm. So if sperm is not there, then it's not there. But if it's there, then we have techniques that we can apply to make sure we solve the problem.
Okay, but a low sperm count, there's still hope, and you know you can change your way of life. You can take some supplements, and it can assist. But obviously, also having it monitored by someone, and you know, at clinics or something.
Definitely. As long as the sperm is there, there is hope. As long as we have sperm, there is hope. Definitely.
Okay, awesome. Thank you very much, Barth. Is there anything else that you want to say with regards to infertility and sperm? You know?
Okay, we just discussed about diabetes, and we know this is a lifestyle disease. As we grow, see, we have type 1, type 2. Type 1 is mostly into children. Type 2 is into adult and older. So basically, it comes with lifestyle. The older we become, our movement become reduced. So we
Yeah.
need to be very aware of that and making sure in our daily life we create time to be in movement. For example,
Yeah.
what I do is 4 a.m. I wake up in my bedroom around the bed. I just spend about 30 to 45 minutes just working out. And by 5 o'clock, I'm sweating already. But also, we need to make sure we are aware of what we are eating because we are what we are eating. Make sure we have healthy
Yeah.
food, cut down on smoking, cut down on drinking excessive alcohols, and have a lifestyle that allow to be able to reproduce definitely.
Awesome. Thank you so much, Barth, for your time this evening. And guys, again, if you have any questions for Barth, please put it in the comment section, or you can DM me, or you DM Barth directly. He's at Repro Lab. He's got an Instagram page. He's got a listing on our site, and you can actually contact him directly as well at Repro Lab. Can you give your details, maybe your email address or contact details, please, Barth?
Okay, for our listeners or viewers who want to contact us, you can reach us at info@reprolab.co.za. We are on Facebook, Reprolab, and we are also on Instagram, as you can follow us. And
Yeah.
yeah, those are the two places, but yeah, we can get to us there.
Awesome.
And
Okay, so if you
our
guys have any,
cell
yeah.
phone number is 073 We can drop us a WhatsApp message there and we'll make sure we reply to you.
Okay, awesome. Thank you. What I'm going to do at the end of the video, as always, I'll put Barth's details at the bottom so you can contact him directly. And he's also tagged in on the video, so you guys can also just follow his page. If you want any updates when it comes to sperm or want to message Barth about anything. Thank you very much, Barth, and have a great evening, and we'll chat to you soon.
Thank you,
Thanks very
Leanne, for
much.
your time. I really appreciate. Sure.
It's a pleasure. Have a
Sure.
great evening. Bye,
Thank
Barth.
you.
Bye,
Bye-bye.
everyone.
Bye.